Reed. I'm a student nurse at Rhodes State College. I'm going to be changing your IV primary pump or tubing. Is that okay? Yep. So I'd walk in, close the door, wash my hands. Next thing I'm going to do is I'm going to grab my physician's order and the MAR and compare the two. So Aquafina, March 3rd, 2000, March 3rd, 2000, allergies, none, allergies, none. So look at her wristband, name Aquafina, date of birth, March 3rd, 2000, allergies are none. So the next thing I'm going to do is I'm going to compare the MAR and the physician's order for the IV infusion order. So it says 0.9% sodium chloride intravenously, 500 milliliters or 5 hours. Okay, so then I'm going to perform my calculation. So for milliliters over hours, we have 500 milliliters over 5 hours, which will equal out to 100 milliliters over an hour. Then we need to get it down to drops per minute. So we know we have 20 drops over 1 milliliter, and we have needed for 100 milliliters an hour, and 1 hour equals 60 minutes, which equals out to 2,000 divided by 60, which equals 33.3. So 33 or 34 drops a minute. Okay. Just try to show that there. Okay, so the next thing I'm going to do is I'm going to get my solution. So I got my solution. I want to make sure there's no discoloration, no floaties, anything going on with it, no leaking. So then I'm going to check the expiration date. It's June 4th, 2020. So then I'm going to do my first check. So individual Aquafina. Medication is sodium chloride, 0.9%. The route is intravenously. The dose is 33 to 34 drops a minute. The time is now, and the reason is hydration. So before I perform my second check, I'm going to compare that with the IV that's already in place, 0.9% sodium chloride. Okay. So the next thing I'm going to do is do my second check. So individuals Aquafina. Medication 0.9% sodium chloride, 0.9% sodium chloride. The route is intravenously. The time is now. The dose is 33 to 34 drops a minute, and the reason is hydration. So before I perform my third check, I'm going to check the IV site. So I'm going to check for any edema, pain, redness, pallor, heatness or coolness. Everything is good there. So then I'm going to do my third check. Individual Aquafina, medication sodium chloride, 0.9% sodium chloride. Route intravenously. The time is now. The dose is 33 to 34 drops a minute, and the reason is hydration. Okay, so the next thing I'm going to do is move the chart out of the way. And then I'm going to open up my bag. My bag's already open. Also, the patient normally wouldn't be this close. I'm just trying to show you all the appropriate angles needed. Okay. So then I'm going to put my clamp on, and I'm going to spike my solution. Then I'm going to put it into my bowl. I'm also going to, I would apply a label. Where's my label? There it is. Just so that the tubing gets changed every 72 to 96 hours, and the bag gets changed every 24 hours. So after that, I'm going to undo my clamp. Allow it to prime at waist level. My bottom doesn't really work that well. Yeah, it goes on and off, and right now it's choosing to be off. Okay, but I would prime that, make sure all that went through in my tubing, and then I would replace the clamp and remove my sheath and undo my tubes and everything. Tape. Then I'm going to hang that on the same one that's not being used yet. Next thing I would do would be to clean my hand and apply gloves. So next thing I'm gonna do is I'm going to pause the infusion pump. I'm gonna take the cords out from the one that's already currently applied. Then I'm going to come to this one and turn the clamp off. Then I'm going to take it off, and I'm going to put it on the same hook that that one is on that's being used as well. So the next thing I'm going to do is I'm going to come over and grab my alcohol swab. I'm gonna scrub the port site for 15 to 30 seconds. Okay, and then I'm going to take my site. I would take off the lid, and I would also okay, my phone had enough. So then I would take off the lid, and then I would insert that, and then secure that with a piece of tape, like that. Normally that's what I would do to keep it there, but I don't want to get the water everywhere, so I'm going to put it back into my bowl here. Now normally attached to the patient, I would undo the clamp again. I want to try to get to the 33 drops, so I'm going to tighten it up a little bit and count for 15 seconds. Okay, so I got it at 9 drops. The next thing I would do would be to reassess my patient, make sure the site looks okay. Then I would make sure they were in a comfortable position, and I would make sure the call light's in place, and take my gloves off. I would also fasten the tape fasten the tubing with tape as necessary. And then I'm going to wash my hands and document. And the things I would document would be that we administered 0.9% of sodium chloride intravenously at 33 to 34 drops a minute. And we also need to document how the site looked, so everything looked fine there, and then how the patient took it, so everything was good there. And yep, and that is it.